Well, good afternoon and welcome to Voices of Faith Transforming the Community. The mission of the Saginaw African American Pastors, known as SAP in the greater Saginaw County region, is that we are a Christian faith group dedicated to addressing racial, academic, educational, social, and economic issues on all levels designed to empower members of the greater Saginaw community. In essence, what we pretty much do is we engage, we advocate, and we collaborate on every level. And today, I have to tell you, first of all, like and share. And let me again welcome the Midland, Bay City, and Saginaw audience. Flint, if you're connected as well, we welcome you. This has to be one of the most important interviews that I am privileged to give on today. Again, I'm your host, Dr. Craig Tatum. I serve as pastor for New Life Baptist Ministries, and I serve as president for Saginaw African American Pastors. This has been one of the most critical interviews that I will ever do because it is relative to me and to men throughout the entire world. And so I'm fortunate today to be your host, but I've got two of the most important guests that I will ever bring into the studio today in the person of Mr. Wayne Parker, friend, brother, co-laborer, and Dr. Toby Long, who is a medical doctor for primary care at Great Lakes Bay Health Centers. So let me just say welcome to both of you. Today's topic, again, you two are experts in so many different ways, and that's going to unfold as we go forward. But today's topic, again, is entitled Men's Health. And I got like two or three stats. I got tons of stats. I just want to give one or two. I know our conversation is going to be layered with them, so I won't steal those. But let me just give two stats, and then we're going to go forward. First of all, understand that 350,000 men die each year because of cardiovascular disease. That's one. 57.6% of men meet the federal physical activity guidelines for aerobic activity. And I can go on and on and on, but we've got tons of those. So I just want to start. Let's get into the conversation. Ms. Parker, you have a story to tell. And when I mean story to tell, I really mean that you got a story to tell.
Sure.
So tell us about yourself as we move into this conversation.
Okay. First of all, thank you, Pastor, for having us on your show this morning. I'm really honored to be here. So I'm a Saginaw BV boy.
Yes, sir.
Born and raised here. And my background is actually healthcare and civic community work. I did a 25-year plus stint at Hurley Medical Center. Most people don't know that.
Wow.
I did 25 years there, working within the HR system there. I was an administrator over talent management and the diversity, equity, inclusion element of the hospital as well. Did that and simultaneously came back home as a township supervisor for Buena Vista for 20 years. So I did both of those at the same time for a nice little stretch. Most people know of my BV supervisor work, but not a lot of people know of my healthcare and career work that I was involved in. I have been involved volunteering for a number of years. I'm a life member of Kappa Alpha Psi fraternity.
Right.
I'm also a certified men's health educator, which is a recent certification that I obtained over the last couple of years due to some of the experiences that I had, and I'll share those specifically shortly here. But I'm just happy to be here and share some of the information and news that I have.
Excellent.
And that's who I am.
All right. And we got some more. You know, he's just kind of teasing us right now. We're really going to creep into his story because it has to be one of the most powerful stories that I have been able to experience over the last several years and hear as well. And I need brethren. So ladies, make sure your husbands are listening. Fathers, make sure your sons are listening. Young ladies, make sure your boyfriends are listening. Your sons are listening as well. We've got to hear that. Now, my other special superhero guest today is Dr. Toby Long. Again, he's a medical director for primary care for Great Lakes Bay Health Centers. So welcome again. Tell us a little bit about yourself, Dr. Long, just as well.
Thanks, Dr. Tatum. It's a pleasure to be here. I spend every day talking with patients one at a time about health and well-being and how to take good care of themselves. And so it's a privilege to come and talk with you too, and hopefully to a larger audience about a really pressing need, which is men's health. It's something that I personally find very important for me because how I feel and how healthy I am matters to my children,
absolutely,
and to my wife, and to the people I work with every day. So it's a hot topic. It's an important topic, and I'm glad to be here. I grew up in the West Coast of the United States.
Okay.
I migrated to the Midwest following my mom, dad, and sister back when I was a teenager in Mount Pleasant. I married a Saginaw native.
Okay.
Her parents graduated from Saginaw High in the late 60s, early 70s.
Wow.
We lived in New Jersey and Colorado and around the country, and then started having kids and realized we need to back up. And I was blessed to find an opportunity to work at Great Lakes Bay Health Centers about 13 years ago, and I've been practicing on the south side of Saginaw for the last 13 years.
Excellent.
And it's been a great privilege.
So tell me, Dr. Long, what are some of the most common issues facing men today and as they age? Talk a little bit about that to us.
Yeah. So the most common issue that I think needs to be on the table for men is that we're not keeping up. So what do I mean by that? So the average life expectancy for a woman in the United States today is about 79 years.
79. Okay.
The average life expectancy for a man today is 73 years.
Wow.
So that's a 6-year gap.
Absolutely.
And before you blame biology, it wasn't always that way. So
Okay.
at the turn of the century, 1900, the gap was about 2 years.
Wow.
So we have seen a spread over the past many years, and there's a lot of reasons for that. One of the reasons is that guys don't always like to go to the doctor.
Correct.
We'll take great care of our cars. Yeah. We'll take great care of our gardens. We'll take great care of our families. Yeah. But me, I don't need any care. I'm just fine as is.
That's amazing.
And I think it's important to recognize that we're not always as fine as we think. And paying a visit to the doctor may be a life-saving move and something that not just we need, but our families
Correct.
and our community needs.
And I think I need to underscore to the brethren right now, and you'll hear this over and over during the course of this segment, that you're not just accountable to you. You are the life of your wife, your sons, your daughters, your family, your job, your community. And every time you refuse to check yourself, that extra pain, that shortness of breath, that's blurry eyesight, that's okay, it's taking me, then you're saying to us that you don't matter, and you do matter, and you need to understand that we need you. We need you alive. We need you healthy. Your family needs you, and so it's important for you to understand. It's important for you to get in a health regimen because it's critical to your life. Now, let me just kind of throw in, because now I want to bring back again, Mr. Parker, and this is a good place to tell us your health journey that you have endured, because I think it's critical for people to understand. So talk to us a little bit about it.
Sure. So in 2017, I was diagnosed with cardiomyopathy. In 2017, I went for my annual checkup.
Gotcha.
At that particular time, my doctor, at the completion of that checkup, he said to me directly, looked me in my eye and said, "Go to the emergency room."
Wow.
At Covenant. And I was a little alarmed at that and said, "Okay, what's up?" And he said, "Go to the emergency room. I will be sending this over," and so on and so forth. So I went to the emergency room. At that particular time, I had an enlarged heart.
Wow.
And one clogged artery.
And you weren't aware of that?
I was not aware of that. I was not experiencing any discomfort other than I had a few signs.
Okay.
For instance, perspiration. sweating a little bit more than normal. I've always sweated
Mm.
and perspired during my my youth, and I played sports and so on and so
Right.
forth. So I really didn't give that much consideration.
Now,
at
just
the
so
time.
people know, you were a phenomenal hurdler, right?
If you say so.
and I say that, Dr. Long, because he went to Buena Vista, I went to Bridgeport, and
Yeah.
we competed. We're kind of like rivals, and
Yes,
so
yes.
I shall never forget that Nehemiah type of hurling that you did back during the day. So it was
Yeah.
great. So anyway, go ahead, continue.
A lot of fun back then.
Oh yes,
A lot of fun. I was admitted to the hospital, took care of that, had a stent put in, stayed there for about 10 days.
Mhm.
This was at Covenant at the time.
Okay.
At that particular time, assessment was made that, there's some medication that we want you to take and so
Mhm.
on. There looks as if there's some heart issues and so on and so forth. And I attributed it as, okay, it was an alarm, but it's taken care of. Well, the years progressed. In 2018,
Mhm.
shortly thereafter, had another episode, shortness of breath and some things of this nature. And so I began to further my treatment. I also had the wherewithal to begin to look up, research, study what is
Gotcha.
this diagnosis, what is this going on with me,
Mhm.
so on and so forth. And then also begin to get an opinion of some experts. I reached out to Cleveland Clinic, Ohio,
Mhm.
in Cleveland, Ohio,
Gotcha.
and who is the #1 cardiovascular institute in the country.
Gotcha.
They do very well when it comes to cardiovascular disease and so on. Well, I reached out to a cardiologist. I was able to get an appointment set up, and he began to treat me as a patient. Still with them to this day.
Wow.
In 2018,
Wow.
I received a pacemaker and defibrillator.
Wow.
Things have gotten worse.
Mm.
Still taking my medication, still doing some necessary things to stay here alive
Amen.
and be optimal. And then so that took place for 4 years. My symptoms progressed.
Wow.
They got worse over the years. And in 2020, I received a heart pump. It's
Wow.
called an LVAD,
Yeah.
left ventricular assistant device, but it's a heart pump in
Gotcha.
short, to help my heart pump efficiently.
Wow.
At that particular time, I was told that at some point in time, you're going to need a new heart. So I became fully aware of my prognosis and diagnosis,
Gotcha.
if you will, and began to continue to follow the directions of the cardiologist, continue to take my medication. And also I got on the heart transplant list
Wow.
at that particular time. And then in 2023 of December was when it happened. My heart pump failed.
Wow.
My conditions got worse. And I was rushed to Cleveland immediately and stayed there for 3 months.
Wow.
And I am here today to
Mhm.
tell you that I am so grateful and thankful to God and family and prayer that on February the 3rd, I received a heart transplant.
Yes, sir. I remember.
And so I'm here as a living witness to tell you God is good.
Amen to that.
And also the medicine and the healthcare that I received is essential.
Yeah.
And the support from family and friends are essential. And so I am convinced that early detection, can prevent death.
Absolutely.
I'm convinced that medical management, medical maintenance, if you will, meaning taking your medication, following up with your doctor's appointments, doing all of those things that could keep you alive to this day. So that's part of my journey. It's a lot more than that, but I'll stop right there. We can go further.
You're still jumping hurdles.
Love to.
That's quite, it's an amazing testimony that inspires. And I hope that brethren and women are listening. Again, I want to say to women, stay the course, keep encouraging, because there are a lot of misconceptions about men's health. And I just want to come back to Dr. Long and just ask, what are some common misconceptions about men's health that you frequently encounter?
That it'll never change. That I'm going to be as healthy at 40 as I was at 20 and as healthy at 60 as I was at 40. And men are prone to something I call the superhero syndrome. We like to pretend that age isn't real and that we're always going to be good to go. And I can tell you that, God gave us wonderful bodies, and but sometimes he's getting us ready for heaven. And we want to take care of those bodies as we go. And, there's the top 3 ways that guys die in our country. Number 1 is cardiovascular disease, heart disease, heart attacks, heart disease, heart failure. And the 2 things that contribute to that most are smoking and being overweight. Okay. So there are things that we have a say in. And so, I say to guys, be smart, right? Don't smoke. It sounds simple,
right?
But a lot of times guys show up to my clinic, and not just guys, but patients show up and they want to know about that fancy niche diet. What is the magic food or supplement I can take to make sure I stay healthy? Or what's that prescription drug you can give me to ensure that I'm going to live to whatever age?
Right.
But the biggest bang for our buck is not in the fancy fad diet, and it's not in some fancy prescription.
Correct.
It's in good choices with our food. Okay. And good choices with our habits. If I was to tell you guys what's the number 1 behavior that increases your chance of death, it's smoking.
Wow.
Increases the chance of death 40%.
Wow.
Just smoking. If there's one thing a person can do to prolong their life, it's not smoke. Of all activities and behaviors.
Wow.
Number 2 is being overweight. If you're in that obese category, your chance of death is up 30%. 30%.
And we know, Dr. Long, Saginaw is considered number 1 in obesity.
Yes.
Okay. Now, Saginaw, you need to hear this.
Yeah.
Let me just say it, and please don't get mad, Saginaw, and don't you laugh, middle in the Bay City, but we fat.
Yes.
If I could just say it,
yes.
we fat, we overweight.
Yeah.
And so, Dr. Long, what role again does diet play in men's health overall? And are there specific dietary recommendations that are particularly beneficial? What are some things that we can do?
Yeah. So again, I would say keep it simple and keep it basic, right?
Okay.
So there are lots of diets that are out there. But before we get to the fancy diets, I tell my patients, keep it real. What do I mean by that? There's a lot of fake food in the grocery stores today.
Gotcha.
If we can keep our food real, if it's something that God made, then it's something that our God-made bodies know how to process. If I give my body an apple, my body knows what to do with it.
There you go.
If I give my body some lean meat or some fresh fruit and vegetables, my body recognizes it and processes it, and I tend to do well. If I give my body Mountain Dew, what fruit did Mountain Dew come from? God doesn't even know. Okay. There's a lot of stuff in that supermarket, especially in the middle shelves, that's been processed and packaged, and it's not actually real. And it's hard for our bodies to recognize that. And those foods tend to lead to increased weight gain, increased fatigue, increased depression. We're less likely to exercise.
Wow.
And we're more likely to end up with various chronic diseases.
So how critical then, and you hit so much stuff, but I'll come back to one that's just immediate. So how critical is physical activity in the life of men?
Oh boy. Huge. Like we need the whole congregation to say amen.
Yes.
Amen.
So just a couple statistics. So people, you don't have to be a marathon runner to get benefit. Okay?
Gotcha.
As little as 1 hour of physical exercise in a week.
Wow. In a week.
Will lower this fancy thing called all-cause mortality. That's a fancy statistic for the chance you'll die. 1 hour a week will lower your chance of death by 15%.
Wow.
Okay, now I'm not counting that I got to walk from my couch to the kitchen pantry.
Right.
I got you.
I'm saying some dedicated physical activity where our heart rate goes up. All right.
So walking down the street, walking on the track. What's some other examples?
Do what you love.
Okay.
If it's pickleball, play pickleball.
There you go.
If it's shooting hoops with your kid or with your neighbor,
Mhm.
you know, if you're
Physical activity.
silver sneakers, aerobics, running, walking, get that heart rate up, and you're going to get benefit.
And our insurance agencies are giving us those discounts. Like you said, silver sneakers. What's the other one?
What is it called? There's a number of programs within these community centers, the Y,
Yes.
all types of programs. I
Yes.
can't think of the one offhand, but there are many that you can utilize and take advantage of.
And guys should know that more is better. So if we get benefit from 1 hour a week, if we can bump that up to 150 minutes a week, now that's a bit of a tall order.
It
But
is.
we're going to double our benefit.
There you go.
Our chance of death goes down 30%. So it's a substantial benefit. I tell my patients, movement is medicine. In fact, movement is better medicine than anything I can write.
And so, you know, turning the TV off and going out, just walking around the block.
Sure.
You know, and let's just sweeten the pot a little bit, because in my neighborhood, I see this often. I see some of our seasoned gentlemen walking the neighborhood. When I say sweetening the pot, walking hand in hand with their sweethearts.
Absolutely.
You know, because we don't do that very often.
Don't get any better than that.
It doesn't, does it?
You know, it just leans towards the support base. And quite frankly, there are women that are key factors to a man's health.
Absolutely.
Particularly in most households, women are the captains of the healthcare plan.
Absolutely.
And they are the ones that set up the appointments and so on and so forth.
Absolutely right.
So there are some things that are going to be happening that the fraternity are going to be putting together to address the issues of what women need to know about men's health.
That's great.
And they need to be engaged in it as well. I can't tell you the support and the love that I received from my wife throughout that journey as well. It's critical on both fronts. It's critical when you are going through the journey, and it's critical when you're in the jungle, so to speak, and to carry you out of that jungle, to have that support base as well.
And see, men don't care about women scheduling appointments, but scheduling for the kids and yourself.
Right.
Okay. Women know our healthcare benefits better than we do.
They recognize signs and symptoms before we do.
Absolutely. They know us better than anyone. And so, hey, I got to take a quick break. Like I said, you know, we got to have part 2 to this conversation. You guys know that already. And we're going to get into some more critical issues on the other side. But let's take a quick break. We're going to come back in just a minute or so talking about men's health. Again, one of the most critical conversations that we could ever have. Women, I hope you're taking notes. Brothers, I hope you're listening. And I hope that you're willing to yield and say, I need to go for a physical. I hear people say this all the time before we go to our break. I don't want anybody checking me. Check me. Stick me wherever you need to. Poke me wherever you need to poke me, as long as you tell me I'm in good health.
Right.
All right. We'll be back in just a minute. Stay tuned. And we are back. And again, I'm here with 2 of Saginaw's finest superheroes, if I could use those phrases, because they're both critical based on their testimonies, their, again, professional expertise, and just good information. And I think it's critical, again, we're talking about men's health, and I want to push us to talk a little bit more about something more particular that has plagued the entire country for the last 3 years, and that's stress and mental illness. I think those are issues we don't talk a whole lot about. And so I found some very startling stats. I want to give one of those if I can, and then we're going to have you guys kind of open us up again. Mr. Wayne Parker, Dr. Toby Long again. Let me give one. Younger men, U.S. men, are more likely to report feeling overwhelmed by stress than older men. with 50% of men ages 18 to 34. Hear me, mamas. Hear me, young ladies. Hear me, fathers and brothers, reporting feeling overwhelmed by stress most days. That's a red flag to me. Okay. I'm concerned about that, because what that says is there's so much pressure. And realistically, and you can talk more about this, Dr. Long, the pandemic exposed a lot of issues that we did not know were out there in our culture and in the lives of young people. So Dr. Long, talk to me about stress and how it's impacting men.
Well, I can tell you, Pastor, and you know this in your work, that hope is healthy, right?
Yes.
And it's critical that all of us have that element of hope in our lives, not only to feel healthy and be healthy, but to pursue things that foster health.
Yes.
Right. So a lot of times you'll see guys, when patients get in the rut where they're drinking too much or they're isolating too much, that short-term gain of maybe this will make me feel better in the moment leads to long-term badness. And we know anxiety goes up, depression goes up.
Yes.
We know statistically and nationally, men are far more likely to commit suicide and be successful. And they're far more likely to be victims of homicide. And they're far less likely to make it to 100 years old. 80% of Americans who hit their 100th birthday are women.
Wow. And so between the two of you, what are some of the signs? Because maybe we just don't know. Well, that's just Bobby. No, that's not just Bobby. That's a red flag. What are some signs between two of you that a man might be struggling with mental health issues, and how can loved ones offer support?
Well, there are many. And I think probably some of the obvious ones are quick to get angry, anger, frustration, which is abnormal in some instances for men, being on edge all the time, indecisiveness, some of those kinds of things. And then two, depression, not feeling so up. And being moody, that kind of thing, and feeling down. Those are signs and symptoms that one could identify. I think it's important, though, once those signs and symptoms are noticed, that one should begin to talk with someone or seek out to talk with someone on the professional side to try to get some help. That's the challenge.
Right.
That's where the challenge comes in.
There you go.
Because not many men would say, oh, I'm comfortable with talking to a psychiatrist or a head shrink or someone like that. That's not necessarily a man's thing.
Well, it's a sign of weakness. Yes. Perceived weakness.
That's a sign of weakness.
Right. Yes, sir.
So I say, and I suggest, we all have mentors. Adult men have mentors, have advisors, spiritual advisors, even folks that you can talk to, men that you can talk to. Not to mention, your mentor doesn't have to be a man. It could be a woman as well. But a man mentor is somebody that you can go to and talk to about your feelings of inadequacy, of depression, of anger, and you're jumpy and those kinds of things. And I think that's important.
So Dr. Long, help me with this. And I know you know this. How can men overcome the stigma associated with seeking help? How do we help men overcome that? And I need the ladies, I need you, brethren, to be listening to this, because it is a real stigma. It's associated with weakness. It's associated with, I must be crazy. Women have gotten to a point where, that's just him. When he in a mood like that, I just give him his space. No, you don't need to just give them their space. You need to do something. So help us with that. How can we overcome? How can we help them overcome that stigma?
Yeah, I think to the extent that we see men withdrawing into themselves and relying on substances rather than people, relying on maybe habits or bad habits rather than family or faith, it's imperative that we knock on each other's doors.
Correct.
We're not made to be siloed off in our own corners. We're made to be a body and together. And I might be the hand, and you might be the heart, and you might be the head.
He's preaching right now.
Well, no, but
that's all right.
We need each other, right?
Yes, sir. Yes, sir.
And so I see it often. I can't tell you how often I have a guy in my office that looks at me, and you know what he says? He goes, "I'm only here because my wife said I had to be here." I'm only here because my girlfriend says I should talk to you.
I got you.
And so I think anytime there's that sliver of light and that door's been cracked,
Mhm.
where like a guy says, I don't really need to talk to you, but maybe,
Right.
Mhm, mhm.
That's the door.
It's an
You got to
opportunity.
walk on in.
it's an opportunity. We need to knock on each other's doors. We need to check on each other because absolutely we need each other.
And I think it doesn't matter your age. Very simple questions. There's tons of commercials that come on where you've
Mhm.
got young people checking with other people. Are you okay?
Mhm.
Simple things. Are you okay? How are you feeling? On a scale of 1 to 10, 1 to 5, what's going on? We've got to love each other, care enough about each other that we're willing to risk delving into your personal space to make sure that you are doing okay. And I don't think we do
Yeah.
that. So I think we can all agree that men must do better taking care of themselves. So tell me, between the two of you, Dr. Long in particular, what routine screenings and checkups should men prioritize, and at what age
Mhm.
should they start?
Mhm.
So generally, I don't mean to avoid your question, but I think it's important to say this.
Go ahead.
Generally, they just need to come to the office.
Gotcha.
Okay. So Great Lakes Bay Health Centers, we have about 56,000 patients we care for.
Mm,
Despite the fact that in our care region,
Mhm.
there's an equal number of men to women,
right.
only about 40% of our patients are men.
Right.
So I think women are accustomed at an earlier age to go
Mhm.
and see their healthcare provider.
Correct.
There's screenings that start. We get cervical cancer screening at
Mhm.
age 21. You come out
Mhm.
of well child checks, and
Mhm.
immediately there's things you need to go and do with your doctor.
Mhm.
Men don't have that until 35
Wow.
or 40 or
Right.
45. And so we get into a lull where we think we don't need to go see the doctor.
Mhm.
So I think my first take home point is however old you are and however long it's been
Mhm.
since you've seen a doc,
Mhm.
make an appointment.
And that goes. Can I go back to this whole thing? Well, when I was in college, I was active. I was in
Yeah.
a fraternity.
Yeah.
I did this. I did that.
Yeah.
I don't need a doctor. I'm just in my career. I'm
Right.
enjoying life. No, schedule an appointment now.
Yeah.
That's what you're
Absolutely.
saying.
Yes.
And I want people to hear that. Come on,
Yes.
talk.
I want to piggyback and add to what Dr.
Mhm.
Long is talking about and get to some more specifics. You talked about age.
Yes.
So studies show that men between 20 and 39 should get a healthcare physical every 3 years.
Okay.
Between the ages of 30 to 49,
Mm-hmm.
every 2 years.
Gotcha.
Between the ages of 49 and 50 on up,
Mm-hmm.
every year.
Okay.
And that will be a better gauge for men to follow.
Mm-hmm.
Yes, when you were young, you were not necessarily in
Right.
need of a physical checkup.
Right.
You were vibrant, you were ready,
Right.
and so on. And you didn't have those signs and symptoms and things of this nature.
Right.
But as you grow older, it's important
Mm-hmm.
to get those checkups. I always say, know your numbers.
There you go.
And there are just a few. One is cholesterol,
Mhm.
and the other is BMI, body mass index.
Gotcha.
Your weight.
Right.
You know those numbers.
Mhm.
It's a snapshot
Mm-hmm.
of your health.
Mm-hmm.
If they're high, and blood pressure is added to those
Right.
numbers.
Right.
If they're high and abnormal, something's telling you, your body is telling you something's going on,
Mm.
and you need to get it checked out.
Mm-hmm.
That's called early detection,
There you go.
prevention.
There you
That
go.
prolongs your life. And that's the point that we try to hone in with men. Just get it checked out.
Mm-hmm.
Knowledge is power.
Right.
What you know.
Of course.
That's right.
If you know it,
Mhm.
then you can do something about
There
it.
you go.
Fix it,
Mhm.
correct it,
Mm-hmm.
and live longer
Mhm.
and continue to take care of that job.
Now, let
that
me come
family.
back to something that we said earlier. I think Dr. Long said it, or you said, Brother Parker, said at the beginning. And I'll give you just a human analogy. Right now, in my car, there's a sign that says, go in for an oil change.
I see where you're going.
Okay.
Yes.
And it's amazing to me that most men religiously
Yep.
follow that guideline. And I'm thankful that the car tells me, and I get an email just as well.
Yeah.
You know, you should be getting ready to schedule.
Yes.
Okay. But, you know, we're here knocking in the engine. We hear the brakes grinding.
Yeah.
You know, I'll be all right. I think I can get another couple weeks, months out of it. No, you can't. That's a red flag. You need to go in and get something done.
Yeah.
And so, you know, when we talk about this preventive care, everything from dental checkups to eye exams, all of the above, you gotta start doing that stuff right now.
I couldn't agree more. If I can just add to that too, I think it's so important for a man to have a primary care doctor.
Yes.
Okay. A doctor that you can call and go in and check up on some things that you are experiencing. It's important because they can guide you through some really difficult times and be part of your preventative maintenance management healthcare plan.
Absolutely.
For me, that's how I would my cardiomyopathy diagnosis was identified.
Wow.
My primary care doctor spotted some things and told me to go to the emergency room. And so I'm forever grateful for that. But I also had annual checkups at the time. And so, so we encourage men, get a primary care doctor. If you don't have one, Great Lakes Bay Health Centers can help.
Amen to that. We got your plug in for them. Yes, sir. Got to throw that plug in.
Yeah.
You know, it is. Go ahead, Dr. Long.
I just want to say one thing to follow up on that is I think most guys would say that independence is manly, right?
Right.
Like a lot of guys don't like the idea of somebody taking care of them.
Yeah.
Okay?
Correct.
Yeah.
But independence starts in your 20s and in your 30s. And I tell patients when they're feeling good in their 40s, how much you exercise and what you eat and don't drink or don't smoke when you're 30 and 40 and 50 is going to say a lot about what you are able to do when you're 60 and 70 and 80.
You go.
Big time.
Yeah.
If you decide to start thinking about your health at age 70, chances are you're going to need a lot of help doing that.
Wow.
But if you've been thinking about your health since you were 30, you're going to be sailing, God willing, sailing on your own. So, I mean, we've got 2 strawberry patches in my backyard. Okay.
Okay.
And my kids have the chore of picking the weeds. All right. If they pick those weeds once a week, it's like a 5-minute job. Have they always done that? No, they haven't. And there's been times I go in the back and you can tell, oh, it's been a month.
Yeah.
Who wants to pick the weeds now?
Wow.
Nobody.
Wow.
And it's a really hard job. And I can tell you, medicine, we are good at small problems. And you have House MD and you've got all these TV shows with these heroic interventions. And you are a great example of the heroics of modern medicine.
Right.
But you went through a lot of hurdles and that was not easy.
Absolutely.
And most people are going to prefer to try to avoid some of those heroic hurdles and take care of themselves as they go along.
And can I throw this in as well? Because this is critical and this will push us a little bit because I want to talk about resources or programs that's available. You know, if you have a job that's giving you healthcare perks, benefits, what's the use in the healthcare perks and benefits if you don't use them?
Right.
You know, you have certain things that you can do every year. You know, they give you those. And you've talked a little bit about that. And I want to encourage men to understand that if you've got health insurance, use it. There might be some costs, but I'd rather pay those costs on the front end than the monumental costs on the other end.
Sure.
Okay. That's right. I think, can you talk a little bit about that to help us understand that significance?
One of the things that I think men should know is to take advantage of those workplace programs.
Gotcha.
I think there are so many places of employment that have work health, fitness, health and wellness programs that they can participate in. It's really easy. It's paid for by their insurance. It's paid for by the company they work for. But get involved, get active, and be a part of that. That's one aspect of it in staying healthy and staying fit. Recognizing it early is a key. Prevention is early is a key. And I think too, the dynamics of healthcare for men has to change within the system itself. And what I mean by is healthcare organizations, agencies have to begin to talk men's health more than they have. You can go anywhere in this country and there will be OBGYN clinics, family health centers, women and children's centers. But you will rarely, and never find men's health clinic,
Yeah, we
men's
need one of
health
those.
services,
Absolutely.
men's health programs.
Yeah, that's right.
Absolutely.
So the system needs to begin to change its paradigm as well, and begin to think about healthcare, men's health differently.
And just if I could, I could become a preacher right now. Scripture tells us that the Bible says that we should be in good health.
Yes.
And we're not doing that. We're not being good stewards.
Yeah.
And so, if I could take that piece and make sure people understand when we're not doing it, we're being disobedient.
Yeah.
If you say you love God, you obey God. Okay, God said, okay, stay healthy. That means you need to stay healthy for yourself, for your family, for your loved ones. Yes.
That's right.
Yes.
Yeah.
We are, we are products of our decisions. Decision we make, we'll see them later on. And I think that's critical. Now, one of the major issues, Dr. Long, that we know is very prevalent with men is prostate cancer. So talk to me a little bit about that.
Sure.
Because here's one of those very taboo issues that we don't want to talk about. We don't want to get anything, but talk to us about that.
Yeah, so it's important to talk about because if we don't know about it, we can't prevent it.
Right.
So prostate cancer is the number 2 killer of men
Yes, sir.
in terms of cancers in
Yes.
the United States.
Yes.
Okay, so lung cancer is number 1, prostate cancer is number 2, and for men, colon cancer is number 3. We do have screening for prostate cancer.
Gotcha.
And depending on your family history and your ethnic background, the screening is a little bit different. So all men need to have a conversation with their primary care provider between the ages of 55 and 70
Yes.
about prostate cancer screening. Okay. If you get prostate cancer earlier in life, meaning say in your 50s, chances are that's an aggressive form and we need to treat it and find it.
Gotcha.
Okay. So you should talk to your doctor about that.
Okay.
If you have a family history where your dad or your brother or somebody close to you in your family died of prostate cancer, you should be screened.
Wait, say that again. I want to make sure people hear this. Say it again for me.
So the technical term is first degree relative. So if you have a brother or a father or multiple members of your family who were diagnosed with prostate cancer, you need to be screened.
Now, let me throw this out there. Is that relative to heart disease, things like that as well? Because I want people to hear that if there is a history of this type of stuff in your family, that's a sign, okay, I need to do something. Go ahead, keep
That's
going.
correct. Yeah. I mean, knowing who you come from and what the health of your family is plays a huge role in what I need to do to take care of you.
Excellent.
And with respect to prostate cancer, that's especially true. And I want guys to know, don't be afraid to ask for prostate cancer screening. Okay. In today's world, prostate cancer screening is really generally and usually as simple as a blood test.
Can I say this, Dr. Long, as when you say ask for it, I shall never forget that a friend of mine takes his father to the hospital.
Yes.
And he goes in and the doctor says, how you doing? I'm doing fine. Any problems? Nope. Son said, wait a minute, Dad, we brought you to the hospital because they say, no, I'm doing fine. He says it's the doctor's job to discern if he's got health issues. This guy was so proud that he wouldn't say what his issues were. And what I hear you saying is you've got to tell someone when something doesn't seem right, when you're going to the bathroom and something ain't seem right, or, you're dizzy getting out of the bed, or shortness of breath, or lost weight. All those are signs that something is wrong. Go ahead, continue.
Yeah. And then I think it's important in this discussion today to recognize too, if you're African-American, your chance of dying of prostate cancer is almost 2 times greater than if you're not.
Wow.
So for African-Americans, they should start having this conversation with their doctors at age 40. So it's an important thing to have. Now, it's not something that needs to be screened for everyone.
Gotcha.
So prostate cancer is also the slowest growing cancer that exists. So we have to be a little bit careful because we don't want to identify a cancer that wouldn't ever affect you until you were 120.
I got you.
Because there's a lot of things that can happen, surgery and radiation, that if it never was going to affect you, but that's complicated. The point is, if you got a family history, if you have symptoms, if you're African-American age 40 or older, or not African-American and 55 and older, you need to have a conversation about prostate cancer.
Excellent.
Yeah. I can just speak to the family line as it relates to healthcare. It's one of the reasons, excuse me. It's one of the reasons why doctors always ask you, did your family have any history of this or that or that or this?
Yes.
And for me, my number came up. It's definitely part of my my gene pool
Okay.
and my family.
I got you.
My father was a triple bypass a patient. He had it at the age of 70. His brother and sister both passed away of heart attacks.
Wow.
So eventually it came down the bloodline. My number came up. But those are some of the things that one must understand. And that's the reason why a doctor asks about that family history. You need to get those things checked out. And then even if you are younger and you got family history, we talked about the ages 20 to 39 every 3 years.
Right.
But if you have a history in your family of some diseases, you may want to step up that checkup a lot earlier than normal.
Well, and I want to piggyback on that.
Go ahead.
You mentioned symptoms and you mentioned symptoms. And I think it's really important to re-emphasize, if you're having symptoms, please let your doctor know.
Yeah.
That's
and
a
what are
roadmap.
some of the symptoms, just so we know?
So symptoms would be weight change, unexpected,
Gotcha.
going up unexpectedly, coming down unexpectedly. Your bathroom regimen has changed. It's happening more. It's happening different. It's not happening.
Gotcha.
Okay. New pain, right? That one thing, if you know you're playing football with your family and you get tackled by your kid and your back hurts, that's one thing. But if you've never had back pain and you now have back pain, you need to let your doctor know. So I would say I don't want to limit it too much. If you've got a new symptom or a change in symptoms, let your doctor know. But I don't want to limit the guys who think come in to see the doctor. So the two biggest killers in our country right now, cardiovascular disease is number one, right? What contributes to that? High blood pressure and diabetes. Guess what kind of symptoms people have with high blood pressure and diabetes early on? None.
Wow.
Hypertension is it's called the silent killer.
Yeah.
You don't have to have a headache and chest pain to know you got hypertension. By and large, the symptoms of hypertension are nothing.
Wow.
So it's a reason to come get checked out. And these are diseases that take their toll over 5, 10, 15, 20 years. So we want to see them. We want to catch them when the weeds are small.
Absolutely.
If you know what I'm saying.
I'm with you.
Yeah.
You know, and obviously we have to come back to have part 2 of this conversation because it's too much. And I really want to push men because there again, I'm a male as well. I've got 2 sons. My father's 89 years old. He had bypass years ago. I've got several brothers and they all have different issues, but it's critical.
Yes.
And I need to be able to push the brethren at the church as well. So I think that's critical. Now, coming up soon here, Kappa Epsi Psi has a men's health educational form. I need you to talk about that because I need people to know it's coming. What you talk
Love
about
to. We've been doing men's health fairs for the past 12 years, sort of being sounding the alarm, beating the drums about men's health. We recognize the issue. We're an all male fraternity. So we recognize this from a personal perspective. Coming up this October, next month, we are putting together and launching a call to action campaign. It's a Men's Health First Symposium. Men's Health First. It's titled appropriately because men put everything else in their lives first.
Excellent.
And this Men's Health First Symposium is sort of the key theme and the message. It's time to have a discussion. It's time to have a great talk about men's health and what we can do about it. But more importantly, identify resources out there, identify access, and identify some ways and measures of how we can attack it and change the tide. And so that's coming up October 24th at the Saginaw Arts Museum and Gardens. It's geared towards the healthcare community, the mental health community, those professionals, the faith-based leaders, community and civic leaders. We want to begin the discussion because you're in the driver's seat as it relates to how that organization moves, what that organization begins to talk about within itself. Are you going to start talking about men's health? Are you going to inject some men's health programs within your organization? We want to begin to talk about that. And so that's coming up. We have a great panel that's going to be present at that particular event. And we hope that folks can come on out. We're on our Facebook page, our webpage, so it's out there.
Excellent.
Great
Look,
work.
I got to stop now.
Yeah.
Let me, Dr. Long, again, thank you. Brother Parker, thank you.
Thank you.
Thank you.
My engineer, Brother Matthew, thank you. Thank KISS 107, Saginaw American Pastors. We're coming back part 2. Stay tuned. God bless you. That's our prayer.